Good morning, my hospice family. Good morning, good afternoon, wherever you are in the world. Welcome back to DunsHospice. My name is Nurse Dawn, your extraordinary nurse, and I am here to talk more about hospice, okay? Please, I want to say that I am so thankful to each and every one of you who has subscribed to my channel. This is such a blessing that we together, you and I, we are able to share the word, okay? Share the word to the world, because I want hospice to be more of like a, what's it called? Like, hospice does not get the recognition that it really deserves, okay? I want us to all recognize that hospice is a great service for our loved ones at the end of life, okay? So that being said, my hospice family, please continue to like, share, follow this channel, okay? And let me know if there's any topic you would like for me to talk about, because I work really hard trying to think about, okay, if I was a caregiver, what would I need to know, okay? Because every single video that I make, I have you in mind. Now, that being said, I want to just share some questions, okay? Share some common questions that I need you guys to make sure you know. When the admission nurse, when the hospice admitting nurse come to your house to admit your loved ones, these are the questions that I want you guys to, have in hand, all right? And I am actually going by this pamphlet right here. If you would like a copy of this, I'm going to put it in the description bar, okay? In the description bar, I'm going to put this for you so you could definitely get yourself a copy, okay? Now, for those of you who may or may not know, I myself, I am a caregiver. My loved ones, okay, my father recently, not too long ago, and I spoke about this in a previous video, I had to put my father under hospice care, okay? So definitely this, I am facing it both ends. I am a hospice nurse and I'm also a caregiver too. All right. So get your piece of paper and pen ready, okay, as we go about what are some important questions, okay? So when the hospice nurse, when the admitting nurse asks you if you have any questions, these are the questions that I want you guys to take out, okay? Take out your piece of paper and pencil and ask these questions, okay? All right, number one. Now, the number one question I would like for you to ask them is, what is your current census? Okay, what's your current census? Because if they are, it depends. If they're a large hospice company, okay, with like over 200 patients, or they might be a smaller hospice company with maybe less than 50, okay? So depending on how many patients they have, this could help you to know, okay, do you wanna go with a larger corporation or do you want to go with a smaller corporation? Now, from my experience, okay, of being a hospice nurse since 2012, from my experience, both, okay, there are some pros and cons on both, okay? So for example, if you are the kind of family, if you are the kind of person who wants that intimate, connection, okay, then a smaller hospice company might be best to go with, because they'll have more time to devote to you, okay? Not so much, it doesn't have to do with the patient, because we care for the patient basically the same way, regardless, okay? Regardless if you go with a bigger company or a smaller company, the main focus is managing your loved one's symptoms, all right? But if you as a caregiver, if you are the kind of caregiver who likes more intimacy, who likes more one-to-one, okay, one-to-one special attention, then a smaller company would be best for you to go with, okay? But at the same time, from my experience, okay, and I'm just talking about from my experience, if your loved ones, okay, has a more needs more help, like for example, like if they need if they have a G tube, for example, or if they have or require like a pain pump, like a CAD pump, like some kind of if they require more sort of like aggressive, extensive treatments, then it's best to go with a hospice company that has a higher census, because these companies most likely will have more resources. Okay, they'll be able to be more flexible in terms of doing maybe IV in the home. Okay, if you want your loved ones to have IV fluids in the home, although that's not part of hospice scope, okay, that's not part of the hospice scope, but if it's a bigger company, they'll be more apt to accommodate you, rather if it was a smaller hospice company, okay, that would not have the manpower or the resource to do so. Okay, all right, my hospice family, are you following? Okay, I hope that answered your questions. Okay, but as always, please give me a comment. Okay, share your thoughts. Hit the comment section. Okay, type and let me know what any questions you have. Okay, any questions you have, let me know, please. I'm here for you. Okay, the second question that you need to basically know before you sign your loved ones under hospice is, will this service be covered by Medicare or Medicaid? Okay, like which one will cover the hospice? Because usually Medicare or Medicaid covers it, but I have encountered some situations where the family has to pay out of pocket. Okay, so before you sign your loved ones, make sure that it's going to be covered by insurance, and if not, okay, work with the hospice company to see if they can if they can just basically sponsor you. Okay, but the first thing to do is make sure you ask. Okay, so that's a question that I really want you guys to know to ask. Okay, so that you know whether or not your insurance will pay for it, like how it's going to be paid for. But like I said, usually 99% of the time, your Medicare and Medicaid will pay for it. Okay, all right. And then the other question, which brings me to, it's which medication. Okay, number 3, which medications. And like I said, I'm going by this pamphlet right here. And if you would like this pamphlet exactly, the link is in the description bar. Okay, just put in your email, be part of my mailing list, and I will send you this. Okay, now number 3 is which medication will be paid for. Okay, which medication will hospice cover? As you guys know, okay, and I've talked about this before, hospice will cover every medication that has to do with the hospice diagnose, and every medication that's also there to manage symptoms for comfort. So for example, okay, if your hospice diagnose is heart failure, okay, it's cardiac, it's heart failure, the hospice company will pay for every medication that has to do with the heart. Okay, that has to do with that, plus medications like pain medications for anxiety, for constipation, for nausea, vomiting, these kind of comfort medications. The hospice company will also cover that. Okay, but it's a good thing. It's a very, very, very good question at the very beginning during the admission to know which medications will be covered by hospice and which medications you will be responsible for. Okay, my hospice family. All right. And finally, the last question, okay, the fourth and last question that I want us to ask in the very beginning is, what additional services will your company, will this hospice agency cover? Okay, because for example, I used to work for this hospice company where they provided with music therapy. Yes, we had music therapy. So we had, therapists who would bring their guitar to the home, who would bring like a flute, okay, who would sing with the patient. We also had a therapist like Reiki therapy, massage therapist. Okay, so these are extra added bonuses, extra services that not every hospice company is required to have. Okay, because the hospice companies, what they are required by law to have is the nurse, the social worker, the chaplain, the hospice aide, and of course the physician, okay, and volunteers. Right? But things like music therapy, massage therapy, Reiki therapy, pet therapy. Yes, I also work with this hospice company that had pet therapy too. So if your loved ones love animals, okay, so this will be an added bonus, because they could bring the dog there, you know, they could bring a cat, whatever the case is, okay, they could bring it straight to the house. All right, so these are the 4 questions by Hospice family that I wanted to share with us. All right, that I wanted to share with us. So please comment. Let me know your thoughts about this video. Let me know if you have any more questions, and let me know if you have had any experiences with the hospice company, with the hospice staff providing any of these things that I listed, and if you have had encountered with these kind of questions before. All right, so share this video with the loved ones who you think will benefit with this video. And I definitely will see you in the next one, okay? Thank you so much for watching. Thank you so much for learning and grow with me in this hospice channel, all right? I will see you in the next video. As always, take care of yourself and each other. See you.